When I was younger, I struggled with a lot of acne, and through time I started getting a lot of breakouts, and unfortunately really scarred my skin. So throughout the years it started just getting worse, and no matter how much makeup I would wear, it was still visible. I got introduced to microneedling and PRP, and with several treatments it's made a big difference in the texture of my skin, and it's really helped with scars. I really enjoy it.
The patient's skin has already been numbed to make the treatment comfortable. Now we're going to put a series of microchannels in her skin before we introduce her platelets. I put a layer of high hyaluronic acid on the skin just to help the needles glide over the skin for the first pass. I want to make sure I put a whole row of microchannels all over her face before we start adding the PRP. Clinical studies have shown that through microneedling, more fibroblast activity has been stimulated by all of the hundreds of micro wounds that I'm putting in the patient's skin. Now that I've made microchannels in the patient's skin, I'm going to introduce the PRP. We have to be very careful because the PRP is not thick like blood, it's actually very fluid. And as you see, we've separated the platelets from the plasma and the hemoglobin, and that's why it's straw colored, not blood colored. So I'm going to put a nice layer of platelets all over her face. And then introduce them into the skin by continuing with the microneedling. And we will do this several times. I'll continue to put layers of platelets on her skin and continue to needle the platelets into her skin. It's actually a myth that everybody bleeds this much. I wish everybody bled this much, but they don't. Some people really don't bleed that much during the treatment. But because we've seen pictures on the internet that everybody looks this way, we assume that everybody's going to look this way. So some patients get a little bit upset when they don't bleed this much, but it's not really necessary for the procedure to work for you to be this bloody. It helps a little bit, but it's not necessary. So was the treatment uncomfortable for you?
Not at all. It's actually pretty relaxing. It's like a deep facial.
But it's not. It's more powerful than a facial will ever be. So you would recommend this to anybody because it's not uncomfortable, it's not scary, it just feels good.
Absolutely. Yeah. It's you know, she takes care of you well, so you don't feel any pain whatsoever.